All right, let's get started. It's my pleasure to introduce Beth Wittry, Environmental Health Officer at the Centers for Disease Control and Prevention. Welcome, Beth.
Thank you. Good morning and good afternoon, everyone. Thank you for having me here to speak with all of you. Today, I'm going to talk about recent data that informs the topic of foodborne illness and outbreak prevention. We will discuss leveraging environmental health data to inform food safety initiatives. Next slide, please. Oh, my slides aren't showing.
Hey, Beth, give me 1 minute.
Great, you can just move on to the next slide, Amy. Thank you. All right, so first I'll begin with a brief overview of foodborne outbreaks and environmental assessments. So as you know, CDC collects national outbreak surveillance data, and shown here is the disease triangle with the respective surveillance systems. So first we have NEARS, or the National Environmental Assessment Reporting System, which captures facility level environmental assessment data from foodborne outbreak investigations. NORS, or our National Outbreak Reporting System, is a comprehensive epidemiological surveillance for all foodborne disease outbreaks, as well as other outbreaks from other modes of transmission. PulseNet is our laboratory surveillance system used to subtype pathogens to connect foodborne illness cases to detect outbreaks. And these systems are integrated to exchange data on linked outbreaks. Next slide, please. So NEARS provides unique data on establishments that have experienced foodborne illness outbreaks. These data increase knowledge about the environmental context of outbreaks and contribute to the generation of hypotheses about their causes and prevention. And because NEARS data identifies gaps in food safety policies and practices and types of establishments vulnerable to outbreaks, they also can help target training and interventions for state and local food safety programs and the retail food establishment industry. As a result, this data has informed prevention recommendations and outbreak investigation practices, which I'll review later in this presentation. Next slide, please. Food establishments are complex systems from receipt to service of food. And any point in the continuum of the food flow, there may be a breakdown of food safety and a potential for introduction of pathogens. In a foodborne outbreak, an environmental assessment is a systematic process designed to gather as much information as possible to describe the environmental circumstances that could have led to the exposure that caused a foodborne outbreak. Environmental assessments help identify the underlying environmental causes of foodborne illness outbreaks related to the internal system variables, such as people, processes, equipment, food, and economics. Next slide, please. An environmental assessment may encompass a range of activities based on the type of outbreak under investigation, how the outbreak was identified, and the suspected route of transmission involved. In foodborne illness outbreaks, environmental assessments are conducted at every point along the farm to fork continuum that is suspected of contributing to the outbreak. Each environmental assessment will be unique to a specific outbreak, and these activities may need to be coordinated with others as it may be dependent on jurisdiction. Assessment activities should include a visit to the location to observe food preparation, interviews of managers and food workers, a review or collection of the records, and sampling for pathogens in the environment. Ultimately, these activities help uncover outbreak contributing factors and environmental antecedents. Next slide, please. Typically, the process starts with identification of an outbreak with people reporting illness and the causative agent. Next, investigators try to figure out how the outbreak happened, leading to the identification and selection of a contributing factor. Next slide, please. Contributing factors are defined as the practices that most likely contributed to a foodborne illness outbreak. There are a predefined set of contributing factors, which can be found on the CDC website. The contributing factors help determine what the root cause was for an outbreak in regard to the contamination, proliferation, or survival of microorganisms or toxins in the implicated food source. Data from these environmental assessment activities, analyzed and interpreted in conjunction with data from lab and epi activities, can help investigators identify the contributing factors to the outbreak. Next slide, please. So once you've identified a contributing factor or contributing factors, you want to identify why it or they occurred. Environmental antecedents are the conditions leading to the contamination, survival, or increase of biological or chemical agents in food. They may be related to people, equipment, food process, food type, economics, or other circumstances. In other words, environmental antecedents are the reasons why contributing factors occur. Environmental antecedents are sometimes referred to as the root causes of outbreaks. Next slide, please. Now we will review the foodborne outbreak data, as this can show us where to focus our prevention efforts. Next slide, please. Foodborne outbreak data shows that restaurants are the most common single setting outbreak location, and prevention efforts should focus on these retail food establishments because most US foodborne disease outbreaks are linked with these types of establishments. Also, Norovirus causes the most outbreaks, accounting for 46% of the outbreaks and 42% of the illnesses. CDC also has data from outbreak investigations that tells the most common factors that contribute to outbreaks in restaurants. Almost half the outbreaks with identified contributing factors are associated with a worker who is determined or suspected to be infectious. These data show us where we can focus our prevention efforts. Next slide, please. The prevention of contributing factors are key and show that infectious workers contaminate the food and environment. The prevention measures underscore provisions in the FDA Food Code and CDC guidelines. We should prevent infectious workers from working by establishing policies that require food workers to stay home when they're sick with vomiting and diarrhea. We should be practicing proper hand washing and using utensils and single-use disposable gloves to avoid touching ready-to-eat foods with bare hands. We should be cleaning and sanitizing food contact and non-food contact surfaces, and cleaning and disinfecting after vomiting and diarrheal incidents. The After Healthy People Norovirus work group is actively working on prevention strategies to address norovirus contamination in retail food establishments. This work group is leveraging outbreak data and evidence-based initiatives to inform prevention measures. Next slide, please. So now I'll dive right into the research findings on how to prevent these contributing factors and outbreaks. First, let's start with food safety management systems. Next slide, please. So I know many of you are likely aware of this recent FDA risk factor study with findings showing links between strong food safety management systems and food safety. For this study, food safety was measured by compliance with provisions of the FDA Food Code. A restaurant has a strong food safety management system if it has procedures, training, and monitoring that help the restaurant achieve active managerial control over food safety. I will not review the definitions of procedures, training, and monitoring, as I think this group is well aware of their meanings. Next slide, please. The FDA found that retail establishments with well-developed food safety management systems had fewer out-of-compliance food safety practices than did those with less developed food safety management systems. You can see examples here. In fast food restaurants in the FDA study, restaurants rated as having strong food safety management systems had 1.7 out-of-compliance food safety practices, while restaurants rated as having no food safety management system had 4.5 out-of-compliance items. You see similar results for full-service restaurants, as well as similar findings were also noted in the FDA risk factor deli study. These data point to the importance of strong food safety management systems to food safety. Next slide, please. Recent data from CDC studies conducted by the National Center for Environmental Health support this relationship as well. These studies have found relationships between food safety and the management system components of procedures, training, and monitoring. Here you can see a summary of finding showing a link between procedures, specifically policies and plans, and various measures of food safety. So starting with that first row, the presence of written slicer cleaning policies in delis is associated with more frequent deli slicer cleaning than food workers in restaurants that have staffing plans for when workers aren't able to come to work and have a policy requiring workers to tell managers when they are ill, are less likely to report that they had worked while ill with foodborne illness symptoms. And restaurants that had a policy or schedule for cleaning had smaller norovirus outbreaks than restaurants that did not have such a policy or schedule. Next slide, please. So these graphs show the data from the last study discussed in the previous slide. You can see that the norovirus restaurant outbreaks are largest, with an average outbreak size of 19, when restaurants have no cleaning policy. An outbreak size is smallest, 3 cases smaller, when restaurants have written cleaning policies. Next slide. CDC data also show a link between training and certification in food safety, as measured by practices, inspection scores, and outbreak risk. Delis with a certified kitchen manager were more likely to have proper refrigeration temperatures. Restaurants with a certified kitchen manager had fewer critical violations on their inspections. Restaurants in which managers had food safety training were more likely to use recommended food cooling methods. Workers in restaurants with food safety trained workers were more likely to wash their hands when they needed to. And restaurants with food safety trained food workers had smaller norovirus outbreaks than restaurants without trained workers. Next slide, please. These graphs show the data from the last study discussed on the previous slide. As you can see, norovirus restaurant outbreaks are largest, with an average outbreak size of 28 when no food safety training is provided to food workers. And outbreak size is smallest, 17 cases smaller, when both on the job and classroom training are provided to workers. The pattern looks similar for manager training. Next slide, please. Finally, CDC studies support a link between monitoring and safer practices. In restaurants in which food workers monitor or record temperatures, food and equipment are more likely to be at appropriate temperatures. Next slide, please. So these data indicate that strong food safety management systems are important to preventing and reducing foodborne outbreaks. There are also some relatively new data indicating that state food safety regulations can reduce foodborne outbreaks. Next slide, please. So as we are all aware, the food code provides model food safety regulations for preventing transmission of foodborne illness in food service facilities, and adoption of these specific provisions at the discretion of the state and local governments. The CDC analyzed food codes of 50 states as well as DC for 5 specific provisions. 4 are shown here as all states required hand washing. If a state adopted a provision, you can see it's shaded in that dark blue. And you can see the provisions for prohibiting bare hand contact with ready-to-eat food, excluding ill staff until at least after 24 hours after asymptomatic, requiring certified food protection managers, and response plans to contamination events. So this study was published in 2016, and we are currently in the process of updating the study with more recent state adopted food codes, so it should be coming out in the next year. Next slide, please. So this CDC research that was conducted by the National Center for Immunization and Respiratory Diseases found that states that adopted FDA food code provisions prohibiting bare hand contact and requiring a certified food protection manager reported fewer foodborne norovirus outbreaks than did states without these provisions. These data suggest that regulations can reduce foodborne illness. Next slide, please. So I wanted to include this slide because it really emphasizes using this outbreak data and putting it into action. So the data that's reported to CDC has influenced national food safety policies. Specifically, CDC found that restaurants with managers certified in food safety are less likely to have foodborne illness outbreaks, have better food safety practices, and have better ratings and fewer critical violations on their inspections. You can click, there's an animation. As a result, the 2017 FDA Food Code added the statement that the person in charge shall be a certified food protection manager. Next slide, please. And finally, let's discuss invigorating root cause analyses, which is in the blueprint of the new era of smarter food safety. While we'll be presenting in the context of an outbreak, the same approach can be used for determining why a violation occurred and to help a restaurant operator develop an intervention plan for long-term corrective actions. So I'm showing this restaurant system diagram again. As an investigator, must assess all the inputs and outputs of the system and understand how the internal variables, which are people, processes, equipment, food, and economics, might negatively or positively influence the system, and determine how control measures can help future illness. Determining environmental antecedents can be very challenging, even when a contributing factor has been identified. However, to prevent another outbreak from occurring, identifying and eliminating the root cause of the contributing factor is essential. Evidence obtained both during the environmental assessment and the outbreak investigation as a whole can help guide investigators in identifying the environmental antecedents. The environmental antecedents may not be obvious at first. Often these factors are not covered by regulations, and investigators need to use their knowledge, experience, and professional judgment to ascertain the antecedents of the outbreak. Because it takes a broad view of the entire outbreak and multiple perspectives, reviewing the data with the outbreak team is helpful to discuss investigation findings and identify environmental antecedents together. Next slide, please. So let's review an example of a norovirus outbreak where contamination was identified as a contributing factor due to a sick food worker handling food with their bare contaminated hands. Several control measures may be recommended and are required depending on the results of the environmental assessment. And there may be many possible antecedents involved. So shown here is a fishbone diagram with all the potential antecedents. Don't want you to be overwhelmed by it. Not all these antecedents may be the cause of an outbreak and really the cause of the contributing factor. But this is to more get you in the mindset of identifying environmental antecedent. We really want to focus on the root cause of the issue. And so one method for gaining information on the cause of the outbreak and determining the environmental antecedents is to continue to ask why. The 5 whys is an integrative technique to determine the root cause of the issue, and each question forms the basis of the next questions. So let's do a brief simplified example. As an investigator, I might ask, why was the worker not excluded? And the manager reports that they did not know they were sick. And so why did the worker come into work while sick? And the worker reported because they felt fine, they hadn't vomited in a couple hours, and of course they needed the money. So if you could click, there's an animation. So economics might be at play here as an antecedents under economics and minimum wage. Why did the worker not tell the manager they were sick? They didn't realize they should have reported their illness. So click again, please. So we have a people antecedent going on, and it seems there'd be a lack of knowledge, not knowing that they should report their illness, as well as not come to work while sick. And why did the worker not know they should report their illness? And they reported because the manager didn't train them. And why did the manager not train them? The manager didn't realize this was a requirement and understand the importance of not working while ill. The manager also reported not having an employee health policy. So if you could click again. There is no employee health policy. So in this example, the investigator identified a couple of different environmental incidents that likely contributed to them working while sick, including inadequate or no training, not having an employee health policy, and workers needing money. So in order to do this, you need to continue down this path of these 5 whys. It might be more than 5. Until you run out of questions or actions can no longer be taken to address the response. So this process will be different for every environmental assessment and is based on the observations and interviews. So the questions will flow as you get different answers and you're seeing different practices taking place. So the recommendations around these antecedents and contributing factors is first, we need to exclude sick workers. So that food worker should have been excluded. And the investigator is trying to understand why the worker worked while experiencing these symptoms. So we found the antecedents that are at play are economics and people. Another recommendation is they need to develop and implement an employee health policy. As in this case, this establishment did not have an employee health policy. So the worker didn't know that they shouldn't come into work while sick. So the investigator can support the establishment develop an employee health policy and different ways to implement this policy, as implementation is really key and the manager must understand that policy to implement it. And finally, they need to be trained on this employee health policy and trained not to come into work while sick and notify the manager. We also see, economics as an antecedent. So to combat that, we can allow makeup shifts so that workers not losing money. We could offer paid sick leave. Other ideas are some establishments have established health screening checks prior to the start of a shift. So they can actually identify those symptoms and exclude that worker before the food preparation starts. And even implementing on-call food worker list, as if you're short-staffed, that could help alleviate a burden of understaffing. So these can all help prevent future outbreaks. So this example just scratches the surface of the process of the identification of an environmental antecedent, but can be helpful to get you in the mindset of how to identify an antecedent as well as develop long-term solutions. Next slide, please. So to summarize this all in broad strokes, current research shows that we need to support strong food safety management systems in restaurants. This includes food safety policies and procedures, worker and manager training and certification, and monitoring to ensure food safety procedures are followed. Data from outbreak investigations shows us that prevention of Norovirus should be a priority, and that we should focus on preventing workers from working while ill, prohibiting bare hand contact, and requiring certified food protection managers. We need to adopt and enforce food safety regulations to prevent contamination of food. And finally, we need to invigorate or incorporate our root cause analyses to understand the underlying environmental causes to prevent future outbreaks. So this is meant as a call to action for what industry and food officials can do. And next slide. Thank you. That concludes my presentation. I'm happy to take questions. I think we might be out of time, so I can take questions via chat too.
Thank you so much, Beth. That was just an excellent presentation. We have tons of questions in the chat passable. So if there's any chance you could please respond to those. We are out of time, but this presentation was a massive segue to our next presentation that we'll be talking about foodborne illness investigations. And also we'll be showing the FDA data collection for the Delhi study later this afternoon. So I really want to thank you, Beth. This was a ton of information. When you see the chat, you will see that everyone thinks it was a wonderful presentation and they're looking for more information. So thank you so much for your time. I'm so glad you were here today.